I spent the best years of my life learning the basic biology of biology, which refers to disease. And I took that all the way, without a break, up to the highest level, PhD, Imperial College, London, working on vaccine research. That was with Professor David Gray, if you want to check my credentials. He's last I heard, he was Secretary of the British Society of Immunology, one of the best experts in the country on immunology, internationally renowned, unquestionably a high quality scientist. Now, as for the current government advice, you should listen to it, you should stay at home. As for the NHS doctors and nurses, doing a brilliant job in terrible times. All the best to them. All our well, best wishes to them, and condolences to all the medics who have died as part of this terrible epidemic, pandemic as well. Yeah. It's very important as part of a free society that we are free to represent ideas which are perhaps unfashionable and to have debate. And therefore, as I've said previously, I'm very concerned that the highest debating chamber in the country, namely the House of Commons and I suppose the House of Lords as well, is no longer sitting. So any decisions made by government cannot be immediately questioned by anyone in the opposition. Even if they don't necessarily doubt the government's position, they can still ask difficult questions and see what the government has to say about it. And that's an important part of our freedom and important part of our democracy. And what we're living through at the moment is not only a terrible virus, but it's also a terrible infringement of our civil freedoms. I've said previously that this doesn't have to be this way. As long as the government advice is as it is, then I will join with all those doctors and nurses who say, yes, stay at home. However, I think it's important that the alternative strategy of isolating immunocompromised and everyone else going back to work is given fair hearing and fair debate. And I'm not hearing on any of the news channels, or I'm certainly not hearing in Parliament, I'm not hearing anywhere anyone saying there's an alternative strategy which might work better. That was silenced, the debate was stifled, and that is a worrying sign for our democracy, because we're no longer the great democracy we were because of coronavirus. But it's not only coronavirus, it's because how we've reacted to it. How the so-called medical experts, apparently there's only one pervading view that can be listened to, and that is lockdown, stay at home. And I've told you that in Sweden they're doing it differently, in Brazil they're doing it differently. So there is more than one idea. And I would like to have it debated, please. This is why we supposedly have these debate forums like Question Time, like late night news debates. I haven't heard it. Maybe I've not been looking in the right places. But I would like to hear it. Now, I've told you in the previous video that's just been aired that I've shown you my graphs. This was this one here where I first showed this. Okay, this one here. I'll roll that one up. This one here. This one here. Okay, so I don't want anyone to be in any doubt. I have been obeying the lockdown. I have not been encouraging people to break the lockdown. I have been encouraging people to debate whether the lockdown is sensible and whether it should end. And what's very difficult is the the fact that, of course, just to have this debate is almost heresy. And I think that we need to recognize that it's important that we don't lose our democracy over this virus, as well as lots of people in our communities, and especially including our healthcare communities. So I think that's so then we'll perhaps try and give some realistic update as to what we said in the previous video, and that was, you may remember this message, this being the spike protein, this being the ACE2 receptor. I think I did it the other way, but yeah, it doesn't matter, it will have it in all dimensions, left, right, up, down, whatever you can think of, but the spike protein is more like the fist. And so the question is, will the vaccine be as good as exposure to the actual virus in terms of developing an immune response in the people that do so successfully? And what percentage will do so successfully? Because if they don't, then presumably they die. Yeah, and I should remind you that, in my opinion, it's a very good chance that the reason they're dying is not because they're not making an immune response. It's quite possibly because their immune response is too powerful. And for that reason, you sometimes need, because ARDS is what usually kills people in this disease. That's, I think, acute respiratory distress syndrome. And to the best of my knowledge, that is effectively an autoimmune disease whereby the immune system overreacts. So under normal circumstances, you might think you could use some kind of drug that blocks the immune system, and that might save people's lives. But of course, what the doctors first thought is, well, they need their immune system, otherwise they're going to die of the virus. But that's not true, is it? Because children and young people don't die of the virus. So at the moment, all medical experts are trying to figure out what the mechanism of this disease is, what is actually killing people. And I think it's reasonable to say we don't really know. We don't have the facts. And of course, we're going to have to live through this phase of clinical trials where some people will be getting the placebo and dying, other people will be getting the wonder drug and living, but that's just tough. That's the nature of clinical trials. We've never seen this disease before, and if we don't do it this way, we'll never know what drugs work and what drugs don't. There is some evidence from China that some drugs seem to be a little bit better than others, and I hope, and Boris Johnson, I think just yesterday, went into hospital. So obviously, you know, one would hope that he gets the best drugs that we know about at the time, and he won't actually be enrolled in the trial. And then you realize all the people who are suffering, whether they live or die, if they're on a trial, they're heroes for the next, you know, for the ones that follow. So, you know, it's a very tough time, but realize that doctors won't be giving everyone the drug that might work. They'll be giving people drugs that they have got no idea if they're going to work or not, and some of them people will die because of what they got. But the question that we need to think about then was, you know, what is the real risk of these vaccines producing antibodies that are useless, compared to the fact that some of them, those antibodies they produce, will probably do a good job? And it's very, very difficult to say. I've installed on my computer, and I recommend you all do the same, something called Folding at Home. What this allows is your computer to be to do some data processing on behalf of a research project for somebody somewhere else in the world, and help them understand how the proteins fold, because that will give us an idea as to perhaps where it'll give us an idea of quite a few things, but it might give us a better idea of where good antibodies combined to block. And so when we design a vaccine, we might not give the entire spike protein, because that might be a distraction. So we might just give the small part of the protein that needs to get an antibody response. The problem is that even with 10, 20 vaccines on the market, that they might only give, say, 50% protection each. And I'm not sure that 50% protection is enough to pass the FDA's, the Federal Drug Administration, FDA, whether it's enough to give, to pass their strict, rigorous requirements for marketing. So in other words, a lot of these vaccines, some of them might do a good job, but they might not get a license. If you add to that the fact that the virus is mutating as well, and you've got a much greater chance that lots and lots and lots of good vaccines won't be allowed onto the market. Now, maybe we can change this by changing the FDA rules. And, I'm actually very in favour of changing the FDA rules on vaccines. You may be interested to know. So, because at the moment I think they're too strict, too rigorous, not on the side of danger. When it comes to the danger of a vaccine, I don't want to say if this vaccine is dangerous that you can still give it to people. Of course not. But if the vaccine, as long as the vaccine is safe, if it does no good in a large number of people, maybe even 90% of people, it should still be licensed because it's useful for that 10% of people. And it might be that we need to form an alliance of companies that are making these vaccines to make them as a cocktail of vaccines, just as, say, AIDS patients currently take a cocktail of drugs to keep the AIDS patient, HIV infected people, just as they currently take a cocktail of drugs to stop the HIV virus from causing AIDS, then they should also consider allowing a cocktail of vaccines. But of course, they then need to be tested as a cocktail as well as tested individually. So if they don't cause any problem individually, but help 10% of people, then obviously as you overlap more and more vaccines together, you might get the clinical response you need. And I've already gone to vaccine clinics and had multiple vaccines on the same day, so it's quite possible that we will be seeing that happening, and that I think is a good way to get the protection we need. But let's not forget, at the very best, it's a year away. So what are we going to do in this year? We're going to try and rack our brains and think of everything, even if we, a bit like a chess player, we might look down lines of inquiry that initially we said, well, that's ridiculous. Everybody would say, well, obviously, you don't risk your queen. You don't sack your queen just for a pawn, obviously. But the best chess players will tell you, if you follow that line through, it might be that a queen sacrifice is what we need here. Now, I'm not talking or a rook sacrifice, or a knight sacrifice, or a bishop sacrifice. I'm just pointing out that it's not always simple maths. It's not always the simple ideas that are the best. Sometimes it's a little bit more thought needs to be put into things. And that's what I'm trying to encourage everyone to do. I'm trying to encourage people to say, can we have the debate, please? Can we at least see the best arguments in favour of lockdown debated against the best arguments in favour of what I've previously called isolate immunocompromised? Now, there's a little bit of a worry there. Some people say, well, immunocompromised, do you mean people with HIV? And the answer is no, because they're taking a cocktail of drugs, so they're not immunocompromised. Do you mean elderly people? Depends where you draw the line of elderly. Certainly over 70s and probably over 65s, yes. Do you, cancer patients? I think they probably are. Mothers, pregnant mothers? Quite possibly, yeah. And so I'm back to the idea that we should not only encourage masks, which, it's not too late to say masks are okay to wear if you want. That the government still haven't even climbed down to say that. It's not too late to say it. You can wear them if you want. You can say we don't think there's any scientific evidence they help, but if you think they help, wear them. They could at least say that. So I'm very, very angry that they're not saying that. You know, I really am. I really am. And I'm going to carry on saying that every time I make one of these things. I'm going to try and make that point, because that really needs to be something that people, I think, can get on my side on this one. You know, it's not just me saying it. There's loads of people saying it, including China, Taiwan, Singapore, Hong Kong, Korea. So you know, why should people die? Why should people die? Why should people suffer when you could have advocated something like masks? And I think the reason was that going back 16 years ago when SARS came out, the attitude was, if we encourage people to wear masks, then they might use the NHS supplies and there won't be enough for doctors. And I've said this already, that was 16 years ago. They have had time to stockpile enough masks so that everyone can go to their supermarket and find there's a shelf of masks, or at least bring it in when the pandemic strikes. If it strikes, if it doesn't, so what? We've spent a few £1 million on masks, 60 million people in the country. Those masks probably only cost about 10p to make, maybe less than that, maybe like 1p, 2p. So, you know, at cost we could have done this and we didn't. It's sad that, you know, I mean, Boris Johnson might die, right? And it's all could have been prevented if Theresa May or David Cameron or Gordon Brown or Tony Blair or someone like that had said, let's stockpile some masks, okay? Let's not forget that, right? That's just something that, you know, I don't think we can really argue with at the moment, but apparently the government still don't want to recommend them. Now, that might just be still because they know there's not enough of them. But you don't have to use a surgical mask. You know, you can wrap a bandana around your face. You can wrap a scarf around your face. You can make a homemade mask. You can use a mask that you've probably already got for something like sanding or drilling or whatever it is. You can use a respirator that you might already have for painting or crop protection, crop spraying, I mean. Yeah, so you know, we've got to start, you know, using our heads and thinking, and not just saying, oh, I'll do what the government says because I'm not an expert on pandemics. You know, nobody's an expert on pandemics. Nobody's an expert on diseases. We haven't really had one, have we? What are they talking? Are they saying influenza's a pandemic that we've had before? AIDS or HIV and AIDS? I suppose, but everyone will agree there's been nothing like this, nothing ever like this. And let's have a look at it. What it is not. It is not a disease. If you look at a lot of these models, right, they assume that everyone has the same risk of dying. They say everyone has, like, I don't know, a 10% risk of dying. That's what these models, these flattening the curve models, were based around. They were not based around the idea that only the old people get it, die. You could have given an age and a risk factor to those little dots that run around those little boxes. You could have said, what about next season? And these are the two things you haven't done, okay? So build those factors into the model, because if you don't, you will have the guilt of all these people who are dying, these wonderful people who are dying unnecessarily because you haven't advanced your model to include these two factors. And this is the debate I want to be having. I want to be hearing it on the news. I want to be the guy at Imperial College, okay, I don't know what his name is, but is it Ferguson maybe? The guy who is saying that I've got the model and I'm using this model, I'm going to tell everyone to stay at home, like Robbie Rotten telling everyone to stay at home. And not only are you doing, has this guy achieved everyone staying at home, he's also achieved that your freedoms in your country have gone, that your democratic freedoms, your Prime Minister's question time, your debating chamber has all gone. And not only that, here I am trying to have this debate with him, and he's running scared of having this debate. I'm not seeing it on TV. I'm not seeing it anywhere. Why not? Okay? You've got to ask yourselves that. You can say I'm mad. You can say I'm reckless. You can say I'm dangerous and I've got some dangerous ideas. Then let them be debated in public, and let's hear what they've got to say to my points. If they can answer them, if they can say, we've got answers for that, and here they are, then I will believe what I'll see how it looks, and we'll carry on the debate. But at the moment, it seems that they can't do that. And yet I can tell you without doubt, let's just say, we have to say that the vaccines may not pass clinical trials and the drugs might not pass clinical trials, okay? I know it's terrible, but that's what the reality of having worked in the drug business and the vaccine business for many years has told me, that often you don't get what you want through the clinical trial, okay? So we both, I think, can agree on that. Now, or anyone listening hopefully can agree on that. Even though a lot of things do get through clinical trials, they often take years and years and years, and refinements, okay, that we don't really have time for in this pandemic. But we do have an opportunity to expose our children to a safe version of COVID-19, which is possibly around now, but in a year's time, I can't guarantee that the disease that's going around will be safe for children. Okay, so that's why I think we have to act, and we have to act fast. Okay, otherwise you're going to be left with the children that got it this year it will be them and their descendants that rule the world. The rest of you who supposedly got lucky by not contracting it, you might all die, just be completely wiped out. 90% of the world might be wiped out by the next season's strain. You just don't know. Okay, so because that is such a real worst case scenario, I need to have this debate, and I need you guys to stand up to the rigors of the challenge. Okay, that's really what I'm saying, you know. And these are the 2 points. Did you factor in that the youth are not affected? In other words, they don't die, they just spread. And also, what happens next season if the virus has much stronger comeback in the winter months? As we know, most respiratory diseases are worse in the winter months. Flu, colds, okay, they are worse in the winter months. We know that. So we've got to use the knowledge we've got, okay? And we've got to have this debate, and we've got to ask, is self-isolating of those people who probably should have had the flu jab, is it better? And you know, this I don't even need to bring in the economic argument. Have you noticed? I'm just arguing from the perspective of the children and their immunity, and the fact that your model that's shut down the entire country was flawed. Okay, and if you can tell me, no, it's not flawed, we included all of that data, we've got the basic model that you're talking about, and then we plugged in all the essential details of COVID-19, and it still says the same thing, well, then I might begin to listen to you. But if that's the case, why is there no YouTube explanation of the model that I can look at? Because all the ones I look at do not say that. They don't. They don't. They don't say that. No, they don't. You go and have a look at it. And that's today's. Maybe we'll come back tomorrow. Maybe Boris will be dead. You know, and maybe it serves him right for shutting down our democracy without having had the proper debate. Maybe. Great man that he is. Yes, great man that he is. That was a radical decision to take when you didn't know the science. You wouldn't have done it with an economic model. You would have said, I know economic models, I understand them.